All right, today we're going to talk about the three most common causes that we see for sciatica and lower back pain. And the importance of why you want to find out what the cause of your pain is because many times we'll be seeing a patient who has failed physical therapy elsewhere, they've failed injections, they've gone to the chiropractor, they've tried to do exercises at home, they've tried medications, they may have even had surgery. And what finding the right cause does is it allows you to do the right treatment. So if you're looking to heal naturally without medications, injections, and surgery, and you're looking to get back to normal again, get your life back, and have everything be normal again and feel normal, feel younger, feel more energetic, feel stronger, and not have to think about the activities that you're doing before you do them. So I know one thing that we'll hear is like, I have to think about how I'm going to get dressed in the morning, or I have to think about how I'm going to get in and out of a car. If that is you, the first thing that you want to do, the first step on your pathway to natural healing is you want to find out the cause. So today I'm going to review with you the three common causes that we see in our clinic. So cause number one is this. It's a herniated disc. And a person with a herniated disc, what they'll typically feel is very sharp pain in their back directly above their tailbone. And that may radiate down, that may travel down into the buttocks, less frequently into the groin. And what that person will be able to do if it does go down their leg is they'll be able to take their finger and draw down the back of their leg exactly where that pain is at. So when we see pain, especially sciatica, which is pain, numbness, tingling, or weakness in the leg, when we see that coming from a herniated disc, it's a very specific pain where the person can take their finger and draw it down the back of their leg. So that's a herniated disc. And how it works is this. So if we take a look at So this would be bone, this would be bone. So the classic level, most common level for a disc herniation is L4 and then L5, and then below that is the tailbone. So in between here you have your disc, and then you have your spinal cord running down. And in between each level, so these are called vertebrae, the bones in your back. Your stomach would be up here, your back is here. So this would be a person facing this direction. So L4, L5, and then you have your spine, the nerves, running down here. And what happens is in between each level, in this hole, there's a nerve root that comes out. Several of those nerve roots combine to form the sciatic nerve, which runs down the back of the leg, divides into two behind the knee, and actually runs the whole way down into the foot as well. One of the branches provides the nerves into the foot. So that's why somebody can have a pinch in their back way up top here, right here, and they feel symptoms the whole way down their leg, into their leg. So the classic idea is the more pressure we get on the nerve right here, the farther down the leg those symptoms will travel. And somebody that's suffering from a herniated disc, they're typically younger, so under the age of 35, they usually have had some sort of trauma, meaning like a car accident or a fall, or they do something where they're bending forward over and over and over again, like they work as a drywaller, or they do something where there's heavy lifting and twisting. And what happens with that is, so you have bone here, disc is in the middle, and then when the person bends forward, that disc pushes out the back. And when that happens, that disc can bulge, which is the lowest level of, let's call it non-healthiness. So you have a healthy disc, above that is a bulge, so that's a little bit worse than the disc being healthy. Above that you have a herniation, which is where that disc material actually pops through the wicker weave of fibers that holds it in. So it begins to pop out, begins to put pressure on the nerve. So when we bend forward, that wedges all that disc material out the back towards the nerve. So people with herniated disc pain, they typically have pain bending forward, such as to tie their shoe, to bend forward to lift something out of the the dishwasher, or if they have a job where they're having to bend forward repeatedly, usually what will happen is as they're bending forward, they'll get a sharp pain and they'll stick and they'll have to go back up. So that is classic herniated disc pain. So they're usually, again, younger. They usually have very sharp pain. It's usually from a trauma, or if they're bending forward over and over and over again. So a herniated disc, you bend forward, the disc pushes out the back, and then, so if this causes pain, this usually gives relief. So there's a whole treatment system around treating a herniated disc. But again, younger person, they're relatively easy to heal. And one of the alarming statistics with a disc herniation is if you took 100 people off the street and none of them had pain at all, and you gave them all an MRI, 80% would have a disc bulge or a disc herniation, but yet they're pain-free. So, you know, in one of my videos I talk about, can you heal a herniated disc? We've actually seen it before and after, and we did a survey of 300 doctors in my area here in central Pennsylvania. 78% of them recognize that you can heal a herniated disc, and that it doesn't require surgery, that it doesn't require medications or injections. So that was a survey we did back in 2009 or 2010. 78% recognize that. It is in the research. It's out there. It's now almost accepted as common knowledge that you can heal a herniated disc. One really cool story is we had somebody who found me through a YouTube video. They're in Calcutta, India, and I ended up treating him over the course of longer than a year. We would do a once-a-month treatment via online webcam. And so he had an MRI in the beginning. He had about 18 months of treatment, and then he went out and got another MRI, and it showed complete healing of a 3-level disc herniation. So you can heal this without medications, injections, or surgery. So let's move on to the second most common cause now, and that's arthritis, disc degeneration, and stenosis. Okay, so the second most common cause of sciatica and back pain is arthritis. And if you break the word down, arthritis simply means joint. So arthro means joint. Itis means inflammation. So like dermatitis is inflammation of the skin, tendinitis, inflammation of the tendon. Arthritis simply means inflammation of the joint. And there's two common types of arthritis. One is rheumatoid arthritis. For the sake of this discussion, we are not talking about that. It's the less common of the two. The more common is osteoarthritis, which means usually attacks one joint at a time, and it's not like rheumatoid arthritis is the whole body, so it's systemic. Osteoarthritis usually attacks just one joint. So that's what we're talking about here, osteoarthritis. So the reason that we use all three of these, that we discuss all three terms at the same time, because it's the same mechanism. So somebody that has arthritis usually has degenerative disc disease. I'm going to show you what that looks like here in a second. And they usually have some sort of stenosis. So before we get into what those big fancy words mean, let's talk about who this affects. So I know that if you're over the age of 50, or if you're going to have more than 50 candles on your next birthday cake, if you have pain with standing and walking and you have relief, your pain goes away when you sit down, so whether it just stays in your back or it actually travels down into your legs. I know that if you answer yes to those three questions, so over the age of 50, pain with standing and walking, relief with sitting, there's a 99% chance that you have stenosis, arthritis, or disc degeneration. We also know that if you live in the US, if you're American, and you're over the age of 50, there's a 95% chance that you have arthritis, disc degeneration, or stenosis on an x-ray. So it's extremely common. But because it is common, does it mean that we just have to accept old age? Absolutely not. And there's a lot of help for people with stenosis, arthritis, and disc degeneration that, again, doesn't involve medication, doesn't involve injections, and doesn't involve surgery. So let's talk about what this looks like and also how you can determine if you really have it. So again, we have our classic drawing here. Most common level again, L4, L5. So this person would be facing this way, stomach would be right here, back would be right here, tailbone's underneath. And so this is bone, right here we have our disc, spinal cord running down the back, and then nerve roots branching off in between the bones, one going down the right side, one going down the left. So what happens with age? So if you are over the age of 50, you're probably shorter now than when you were 18 years old. So one of the main reasons that that happens is, in addition to a breakdown in posture, we also get the space between the bones in your back that shrinks down, so they get closer together. That, on an x-ray, is commonly referred to as degenerative disc disease. It means this disc height is now decreasing. Well, what that does is this hole in the back where the nerve comes out, as we lose height within the disc, that also closes down. So when that closes down, and if you can think about this, when we lean forward, when we have arthritis, disc degeneration, or stenosis, when we see somebody with that, when they lean forward, that opens the space up, and when they lean backwards or they stand or walk, that closes the space down. And if you've ever noticed this, next time you go to the grocery store, I am sure you can find at least one person doing this, but the person who's leaning forward on the cart and it looks like the cart is fully supporting them, that person is classic arthritis, disc degeneration, and stenosis. Because the reason that they're doing that is to open up that space in the hole, it's called a foramen, where the nerve comes out. So they usually have a lot of pain standing and walking, but they get relief when they bend forward. This is also the person who will say, if they are standing or walking, I just need to sit down for a minute. That's usually what they say. What they really mean is, when I sit down, my pain goes away, so I need to recharge. And they'll need to sit down for a minute because of that. Now, treatment-wise, there is a lot that we can do for it. I don't really have time to get into it right now, but basically what we're doing is opening up that space as much as possible. This is also the person, in addition to having trouble with standing and walking, they'll frequently have trouble with stiffness in the morning, because throughout the day, gravity will shrink that space, and then at night when they lay down and there's no gravity, that space will almost overfill. And what it does is it causes a lot of muscle tightness and ligament tightness, and usually what that person will have to do is they'll say, I need to get up and move around for 15 minutes, I'm really stiff when I get out of bed in the morning. Or they'll say, as soon as I get a hot shower, then my back feels normal again. So again, a lot that you can do for that. Frequently, this person will also, who has stenosis or disc degeneration or arthritis, they'll also experience a more broad, general feeling down in the leg of pain, numbness, tingling, and frequently weakness. So it can present a lot of different ways, but the main thing you want to look at is pain with standing and walking, relief with sitting, stiffness in the morning. We know if you have that going on and you're 50 years of age or older, really good chance that you have arthritis, disc degeneration, and stenosis. All right, so the third most common cause of back pain and sciatica is a really tricky one. And you know, if anything put us on the map, so the reason more than any other why we have people traveling from all over the U.S., why we're frequently brought in on consultations, even on an international basis, or why anybody ever would hop on a plane to come see us, is because of this reason, because it's easily the most misdiagnosis with back pain and sciatica, and it is rarely looked for on an x-ray or MRI. So what happens, and I just want you to think about this for a second. So if we have a stack of blocks and we move the top block, so we just shift this, what happens? Well, likely that this block will just fall off. So shifting this block only affects the top block because of gravity. So if we go to the bottom block here, the foundation, and we shift that, the whole tower collapses. And when you're looking at your spine, it works very much the same way. So if we just draw this out, this bottom block represents your tailbone, the base, the foundation for your entire spine. And many times when we see somebody who's failed other physical therapy, or they failed chiropractic care, or they failed injections, or even failed surgery. So many times they'll have surgery up higher, like an L4, L5, or L3, L4, and that surgery's failed. It's not giving that person relief at all. Many times what we'll do is we'll go back here and we'll test the underlying SI joint. So this joint between the tailbone and the pelvis, which is right back here. Kind of think of it as in like the dimple beside your buttocks, but right beside your tailbone. This joint right here, called the SI joint, is frequently a culprit for back pain and sciatica, but it presents a little bit differently than classic herniated disc pain or stenosis and arthritis. So what happens here is most of the time, if we're looking at the pelvis, 70% of the time the right half of the pelvis will rotate forward, and that creates problems the whole way up the chain. So we'll see like disc degeneration, arthritis, herniated disc here at L4, L5. And that person hasn't healed with traditional therapy. We'll go here, we'll treat the underlying SI joint problem, which has just been missed. And once this resolves, that allows this area to heal up top. And it can be life-changing, and it can be dramatic. So if you've watched any of the other before and after videos on my YouTube channel, or if you've seen it somewhere else, if you've seen me live in a back pain and sciatica workshop, where I pull somebody from the audience and I treat them. Usually I'm looking for a missed underlying SI joint and pelvic issue, and they can look like almost one-day miracles, just because usually those people have had failed treatments in the past. Now, who is this person? It's much more broad-ranging or wide-ranging in terms of age, in terms of demographics, than a herniated disc. So a herniated disc is usually a younger person, usually trauma or repetitive lifting. Stenosis, arthritis, disc degeneration, cause number 2 is usually 50 years of age and older, sitting, standing, relief with, standing, walking, relief with sitting. SI joint, and here's the reason it's tricky. I've seen it in a 15-year-old young female athlete. I've seen it in a 90-year-old. So very, very wide-ranging. It can affect us throughout our entire life. And let me give you some of the key indicators. 1 is frequently pain or discomfort with sitting or driving. 2 would be pain rolling over in bed, so changing positions. And it's all throughout the night. So if you wake with pain during the night, frequently it's that underlying SI joint or pelvic issue. We've also seen people will frequently complain about pain getting in and out of a car. Now, what can be really tricky is you can usually have somebody who has been experiencing this for a long time. They frequently do have disc symptoms up above. So whether it's a herniated disc or degenerative disc disease, they can have symptoms up here. So they might have pain with standing and walking from arthritis or disc degeneration up above, but they also have pain with sitting when they sit down. So what we have learned to do here, because we specialize in this condition, is we treat this first. Usually this resolves, but if not, then we can go treat up above as well. And it's a really nice combination. It gives the person long-term relief. SI joint and pelvic pain also extremely, extremely common in childbirth, because you pass the baby through the birth canal, through the pelvis expands, the body releases hormones called relaxin that makes the ligaments go lax, and there is no guarantee at all that the pelvis goes back together. So I think there was a survey done a few years back in a spine journal, and I think it was almost 50% of females at the 6-week or 10-week postpartum follow-up have some sort of underlying back pain related to the pelvis and the SI joint. So we do see that a lot as well. And we've even seen mothers that their kid, they'll kind of joke around about it, but they'll say, I've had back pain forever. And when we trace it back, it started with the birth of their first or second child, who's now 36 years old. And I think that's the longest that I've ever seen. But this is very simple to treat when you know what to look for. So it's usually pain with, again, sitting, rolling over in bed, getting in and out of a car, standing on one leg to get dressed or perhaps to shave a leg can be problematic as well. And usually when people have this, they'll shift their weight to the opposite side. So if they have pain on the right side, they'll shift their hips just over to the left to take weight off of it as they're standing. So they're the three causes of of back pain and sciatica. The other thing with this is when, in addition to being missed on an MRI, when somebody gets symptoms down the leg from an underlying pelvic or SI joint issue, it tends to be very, very broad. So they'll complain about pain on the outside of their leg or wrapping over into their groin or even into the front of the leg, but it's broad. So if you remember the herniated disc, they could take their finger and draw a line down the back of their leg. Sciatic symptoms from an SI joint usually almost always have weakness, and when the person draws, shows you where their pain is at in their leg, or if it's you and you're showing somebody where the pain is at in your leg, they'll usually wrap their hand around the outside of the leg over to the front, sometimes even into the groin. And one of the more serious things that we've seen, which happens an alarming amount of the time, is we will see people with leakage. So that's loss of bowel or bladder control, more frequently bladder. And many times with that, and even though it's very embarrassing, many times when we put the pelvis back together, get it to move again the way that it's supposed to, that underlying incontinence or the bowel and bladder problem or the leakage goes away. Because when the pelvis is where it's supposed to be, the muscles within the pelvis can fire the way that they're supposed to, and they can control bladder flow. So pretty cool, little unknown thing. On a more serious note, can also cause pain with sex or childbirth as well. But that is, in an overall viewpoint, that is what happens with SI joint and pelvic pain. All right, so now that we've gone over the three common causes of back pain and sciatica, I have a special offer for you. So what you can do is you can email me, and my email address is chad@3minuterelief.com. So that's chad@3minuterelief.com. I'll edit in my email address across the bottom of the screen here, so it should be right here, right now. chad@3minuterelief.com if you're looking for more help. So now that you have a good idea of what's going on, here's what I want you to do in the email. I want you in the subject line, I want you to give me what you believe the cause is. So if you believe it's herniated disc, or if you believe it's arthritis, disc degeneration, and stenosis, or if you think it's reason number 3, SI joint and pelvic pain, I want you to type that in the subject line. And within your email, I want you to reveal, or I want you to share why you think that is the cause of your pain. So, you know, if you say, hey, I'm 50 years of age or older, I have pain with sitting and standing, I have pain with standing and walking that goes away with sitting, that's why I think I have stenosis, arthritis, or disc degeneration. Just type that in there. You can share as much of your story as you want to tell me, so I can help you out the best. And I have some very valuable information for you that'll help you get your life back again. And some of them I'll just show you here really quick. So a few years ago, after doing years of a seminar called Pain-Free Motion Seminar, now it's called the Back Pain and Sciatica Workshop, I was quite a few people asked me to write a book, which I ended up doing so. We've now gone through 2,000 of these. I'm in my second printing, and this will be renamed, but I can get you access to this. It's Pain-Free Motion for your lower back, relief without medications, injections, and surgery. And in it, I reveal 9 key truths to natural healing for back pain and sciatica. Another thing that I can do is we have these, again, which I made back in 2010 or 2011. It's top 3 exercises for herniated disc, top 3 exercises for stenosis and arthritis, and top 3 exercises for SI joint and pelvic pain. I also do a back pain and sciatica workshop. I can get you a link to that. If you're in the central Pennsylvania area, I can give you an invitation to a live workshop where I share not only successful elements of treatment, I actually treat somebody from the audience in front of somebody, in front of our entire crowd of people, the entire audience. Really puts me on the spot, but I can show what really good sound techniques for natural healing can do in a short period of time. But I can get just some valuable resources. Send me an email, subject line, the cause that you think you have going on, share the reason why you think that's the cause of your pain, and I'll give you, I'll be able to share an offer to get some really valuable resources for you and get you on the road to natural healing and getting your life back to normal again.